Good morning, guys. Welcome back to our channel. When we talk about baldness, class 1 to class 6, there are more treatment options are available. There is a one situation which can be very tricky to patient as well as a surgeon, and that is something called a diffuse pattern. Basically, what is a diffuse pattern baldness is a certain amount of hair fall will happen uniformly. It's not that kind of a receding hairline. You're going to lose hair frontal area and mid scalp and in vertex area. Certain amount of hair still will be there. So that's the reason it's very tricky whether we can do transplant or not. Both patient side and surgeon side will be always in dilemma what to do, and that's the diffuse pattern baldness. We are going to discuss how to handle and how we're going to treat with how do you want to handle the diffuse pattern baldness today. That's what about this video. Usually when someone has a diffuse pattern baldness, it's always better to go with conservative management, kind of taking multivitamins, medications, and bio-PRP kind of thing. At least minimum 6 to 8 months to observe how is the further progression of the baldness. So that's the reason we go with first conservative management, then we can think about hair transplantation. Most of the patients think that I've been trying many medicines of no use, but can I go to transplant directly? But however, always it's better to go with conservative management, not for the growing the hair. At times with this conservative management, probably you may not get hair back, but at least the further progression of the baldness can be reduced and stopped, and then only we can plan for the transplantation. Point number 2, when you come with diffuse pattern hair loss, age is really important matter. Imagine if you are a lesser age, kind of 25, 26, 27 years, it's better not to go with transplantation, because after the transplantation, I'm sure you will lose more hair and you need a second session. That scenario, better to manage with medicines and bio-PRP. And why we are going to give this medication and bio-PRP? Some guys will ask me, what if I don't get my hair back? In that scenario, here the point of giving this medication and bio-PRP is to reduce further deterioration or further hair fall. Then that means we're going to make it hair fall stabilization. Once the hair fall is stabilized, kind of that you've been having the same kind of density that neither you are losing hair nor you are growing much. That point of time, that means hair fall stabilization will happen. Then we can consider a transplantation age about 28 or 30, because 30 to 45 years we supposed to look better. That is the age, even though you got suffering from diffuse pattern hair loss, we can consider the transplantation. However, first mode of treatment is going with conservative management. Then age we check. He is about 28 years or 30 years. He has a diffuse pattern baldness. Then we give medications and bio-PRP 6 months time. Then after that, once the hair fall is been stabilized, then we'll go for the transplantation. Most of the people has a question: what happens if I take transplant when I'm suffering with diffuse pattern? Well, nothing is going to happen. You will lose more hair because the baldness is progressing. Then you would need second session. So if suppose if you are a very younger age, if you plan your transplantation unnecessary area, suppose in the frontal hairline, because youngsters always wanted to have a very frontal hairline where you are going to waste more grafts. That means in the diffuse pattern type, you would need second or third session later on. That is the reason age is the main criteria. So we need to wait at least kind of age 28 or above, so that your personal life or career, personal career would kind of getting better that kind of age. So we would consider hair transplantation. Then by then most of the patient will be matured enough to understand the placement of the hairline, the goals, everything will be changed. So that is the age is the main criteria. So when you do transplantation in such scenarios, I'm sure most of the cases would need second session. The reason is once the diffuse pattern cases comes for the transplantation, what are the hair left on the scalp under the miniaturization, those hairs will definitely sooner or later they'll fall and you end up in complete baldness. So while doing the transplantation, we have to think about that scenario, thinking that he is already completely bald, how to restore hair back with a good natural look. That's the reason the age and planning is most important in diffuse pattern cases. And second thing is second session, probably most of the diffuse pattern cases, second session mandatory after a couple of years. However, before transplantation, we would do medication and PRP. Even after the transplantation, also it is better to consider taking few medications, some multivitamins, and bio-PRP to at least stop the further balding process. That way, you can maintain this implant rate once or twice for a longer duration and good healthy manner too. Well, this patient aged 32 years approached us when he was age 30. We recommended him some conservative management, multivitamins and bio-PRP for 6 months. And we could see the hair fall has been drastically reduced, but we did not see any improvement with hair growth. Then we realized that fine, the age almost 32 years, you would want a hair transplant for the sake of marriage purpose, and age also about 30. We considered one session transplantation after giving a PRP and medication for 6 months. This is the results after one transplantation, and he's on bio-PRP as a maintenance once in 6 months, one session. And now the density is very good, and we preserve the best donor for future transplant also. As of now, his results are excellent, and density, coverage, all looks great. Now, in this patient, what is the risk of doing a transplantation is, I'm sure he achieved fantastic results with a transplant now. Probably down the line, couple of down the line, 3 years or 5 years or 7 years down the line, I'm sure he would eventually lose his existing hair, nor the transplanted hair. That point of time, you need another session. That's the only risk in a diffuse pattern hair loss. Now, conclusion of diffuse pattern hair transplantation is, it's better to consider first conservative management before going for the transplantation. And number two, it's better to consider after age 28 or above. Number two. Number three is usually when you think about transplantation for any of a personal choice like a marriage or career purpose after age 28 or whatever it is, get ready for a second session. Probably you would need second session later on. That's the only risk. Otherwise, there are a few guys will ask me, would it damage my existing hair with the transplantation when you're doing it? Would it damage my existing hair? Some guys will ask me. I don't think so. By doing the transplantation, a lot of gaps we can find and we can implant in between, and that's not the problem at all. So thank you guys. Thanks for watching our channel.